cost if things go wrong? This is a good question. And so all the hospital, and again, check with the hospital you're working at. We work at two hospitals, BMI and Spire are the two sort of big companies. BMI is the Priory and Spire is the Parkway, but they're, BMI and Spire are big sort of private hospital companies. And they've got hospitals all over the country. And they cover you for revisions. So they cover you for 6 months if it's the BMI and 12 months if it's the Spire. They all cover you for 30 days for complications. So said this a bit in the wrong way. Oh dear. I should have started with a 30-day thing. So basically, who cut right? Okay, start again. Who covers the cost if things go wrong? Okay, good question. So what happens is they'll all the hospitals will cover you for 30 days for complications. So complications means hematoma, blood collecting inside, an infection. What other complications? The wound opening up. Something bad happening in the first 30 days of surgery. So that is covered by the hospital. You don't have to pay if you need to go back to theatre, if you need to have a scan, if you need to go to intensive care, perish the thought, if you get heart problems and you have to go to intensive care, and anything that happens, basically, you don't have to pay if you get a complication. That's a complication. If you get a problem, a complication, first 30 days, that's covered. After 30 days, then you're looking more into things what you call revisions. Revisions mean you've all healed up and all that sort of stuff, but one's a bit high or a bit low, or it just doesn't look quite right, or you've got a bump at the scar, dog ear, or it's just not sure about that. It just doesn't, they're too wide, or they're too close, or they're too whatever. So then we get all the one nipples. Anyway, whatever. Could go on all night, but you get the gist. So that's a revision. So that is where they differ. So some hospitals cover you 6 months, some cover you for a year, and there'll be others who do different things. So BMI do 6 months, Spire do a year. To be honest with you, most things are there at 6 months. I wish they did longer than 6 months. Personally, we've been looking at it because sometimes things settle, but people often think, "Oh, I better get it done within 6 months," because they can be reasonable. So we can say to them, "Look, this is one's a bit bigger than the other, but I think it's just a bit of swelling. Can we just leave it another few months, and see how it goes?" So if we talk to hospitals like that, they'll often be reasonable about it. But in general terms, most things are sort of visible by then, and so yeah, so anything like that in the first 6 or 12 months is covered. Again, hospital costs, anaesthetist, surgery costs, you don't have to pay anything. It's bad enough you have a problem, you don't have to pay anything. So that's who covers the cost if things go wrong. After 6 to 12 months, then it's less so things going wrong as something else happening. And as I say, the common thing with breast implants is a rupture or a capsular contracture. If you're having a tummy tuck, it's probably going to be something like you're putting on weight. If you put on weight, the skin stretches, particularly if you put on weight and lose weight. I can't think of what could go wrong later after 6 or 12 months, but then you have to pay. Now, we don't charge consultations to come and see us, but you have to pay for surgery after the 6 12 months. So yeah, so you're sort of covered for the first 6 to 12 months, and then after that you have to pay if you need more surgery. If you just want to come to the clinic for a checkup and you're worried if you've got a bit of this or a bit of that, you can come for the checkup. The other thing I wanted to say, what did I want to say? What was the other thing I wanted to say? Who covers the cost? Oh yes, the very important thing is the thing that is covered is two things. The first thing, the thing that is covered is if things go wrong. So if things don't turn out the way we use the royal we, it is sort of based on the surgeon, how we hoped it would turn out. If they just turn out, if they're just too big or they're just too small, or if the cosmetic result is fine, but you don't like it. So this is, I'm talking really about breast implants really here. If you think beforehand you're deciding between the 250s and the 350s, and you have the 250s and you think, well, actually, you know what, I wish I'd got the 350s. You're like, well, then you have to pay. So cosmetic dissatisfaction in terms of the fact that they look fine, but they're just too small or too big, that is not covered. So that's why we say to people, come back as often as you want, because you've got to be absolutely sure with the implant choice, because that is not covered. If they're too wide or they're too high, or one's up and one's down or something like that, that is covered. That is a complication. But the fact that they look fine, but you think they should be bigger or smaller is not a complication. Um, so that's something which we're keen for you to come back and go over things again. So I hope that's covered that. So